Private sector Senator Christopher Dialli believes since the nursing program available in Grenada was moved to St. George's University, the program has never worked as it ought to. This is as he lent his voice to the contributions to the amendment order to the St. George's University Limited Act, to which he commended government for the initiative. However, Senator Dialli says the practical aspects of the program when it was at TAMCC, specifically training via public hospitals and the Nurses Association, has been left out.
And that program, as a result, never saw the level of quality that it ought to. So I'm hoping in this particular agreement, and it's talk about the nurses program, that aspect of it can be sorted out. And I hear about extra work wanting to be done at our hospital and so on. I'm hoping that that aspect of the nurses program could be properly facilitated so that our nurses are trained to the quality and level that is required.
The private sector senator notes allocations for the US $30 million are lacking, while suggesting a certain percentage be used for the health sector, TAMCC and NIS.
I would have liked to hear something like a certain percentage going to the health sector. And not going into the black hole of the consolidated fund, because you know what happens, Mr. President, when monies reach there. I would have liked to hear some going to TAMCC, for example. In all years, the past years, TAMCC used to get, I think, a grant of $1 million from SGU earlier, and that was removed. And as you know, that institution continues to have serious funding issues.
Labour Senator Andrew Lewis, adding to the discourse, brings into the conversation that since SGU can forgo such funds, then no more than $2 million EC can be used to pay off unvaccinated workers their years of service.
And therefore we are demanding, the labour movement is demanding, that the workers be paid for their years of service. And not only SGU, but any workplaces that have sent workers home. It is also important to note, because we must deal with all the positives and negatives. As we speak, these workers who have not been allowed to come to the compound to perform their jobs have not been paid for their annual vacation leave. And that is all part of the fight that the leader of government business has indicated in the struggle. So we are bringing this to the attention that we must look at both sides of the coin.
Additional scholarships, as well as medical support in the form of 2 full-time clinical members of staff at the public hospitals to be paid by St. George's University, are part of the new agreement between SGU and the Kit Mitchell-led administration. Senator Matthew Joseph, welcoming the legislation and its crafting, expressed his concerns, however, for government's plan for the scholarships and the university's conformity to the new agreement.
You know, in 7 years' time, SGU will be producing 22 new doctors. Let us look at our needs and do a needs analysis and see exactly where we are going to put them.
An experienced, fully paid public health professional to bolster healthcare among hospitals, and a volunteer program of experienced clinical medical doctors from SGU staff to provide service are 2 other benefits of the agreement. I am Gerard Joseph for GBN News.